Hello everyone, my name is Sachin Sharma, Department of Child Health Nursing at the DPCN. Today I'm going to learn about the behavior disorder. We can say as a behavior disorder as the age of the toddler age, which is known as a 1 to 3 year of the age. So let's begin. So what are the behavior disorders in the age of toddler group? So here we are going to behavior problem of childhood. Childhood, that is a age of the 1 to 3 year is we can say as a toddler age, which is in have the behavior problem. So there are the various behavior problem in the childhood. So first one is that is a temper tantrum, breath holding spell, thumb sucking, and nail biting. So these are the thing is here going to discuss one by one. Okay, the first was that the temper tantrum. So what is the temper tantrum? So as a image that's showing that is the anger of the child. Okay, so simple meaning is that the temper tantrum, that is a temper, that is meaning of nature, and tantrum, that is the meaning of that sudden explosion of anger, especially by our children's. Whenever we are observing to the children's, so we are observing that according to their nature, according to their age wise. So tantrum, that is a sudden explosion of anger because of the children's cannot be achieved as a desire and emotions because of there are the frustration and emotions. So what are the definition of that? So first of all, definition, that is a temper tantrum are unpleasant behavior. They are often occur in response to unmet need or desire. Tantrum are most likely to occur in the younger children or other who cannot express their need or control their emotions when they are frustrated. Whenever the children are going to frustrated and having the emotions, strong emotions, so at the time of the ages are the very strong curiosity about that explorer of the area wise. So there are certain interventions about how to manage the temper tantrum. So what are the intervention is said? Whenever we are observing that the children is having a temper tantrum, according to such a reason behind that, according to it cannot be fulfilled by their desire. So how we can as a deal as a parents or as a nurse? So first of all is that the intervention is first, that is a stay calm and speak softly. Whenever you are going to observe that children according to their the anger, you have to just stay calm and don't respond. You have to, most of parents are doing likely as a response immediately whenever the child is react. So you have to stay calm that time and speak softly, gently. You should not try too hard voice, and you should not be try to shout. Ignore and space out. Not every tantrum need a reactions. So second one thing is that the ignore, space out. Whenever you observe that such a type of the tantrum, you have to just ignore that time, not other response. You have to just ignore that the tantrum or anger and space out, giving to that just sometimes. And not every tantrum are need to reactions. You have to not react. You have to react to every tantrum. Give your kid a time out. So you should give to time to the child. Okay, you should say you can say that is a just wait for that 5 to 10 minutes, we will talk about later. So that will be help to this managing their desire or managing their emotions. Second one is that the hug, empathize, talk afterwards. So whenever as a parents we are going to give a hug to the child, emphasis should be maintained, and talk after later will be message to the given to the childrens, and that will be understanding about that what are the going to be done. Don't use no too much. The sentence is that no. So as most of parents are using that is a no word. So most of no word, that will be the ignorance that may be feel to a child. Okay, sometimes we are as a parents going to saying about you should know to go to there, you should know about that. So that type of sentence you should the very much law about you have to ignore, and you other you can skip this one. Okay, that may be going to other step gonna be happens in this lab. Next one is that don't give into a tantrum all the time. So when the children's are desire, we can say as a objectively, whenever we are going to outside a grocery market and the children's are demanding that that particular chocolates and particular toys, so we are just going to ignoring that, and that should be start with the temper tantrum, okay, immediately, and we are going to step taking just, and we have to give that chocolate, okay, we are fulfilling that desiring. So that at that time the child should be understand about how to achieve their emotion, how to achieve their desire. So that time the child should learn about how to dealing with the parents. If mothers like I'm crying in front of mother, and mother will be given immediately at that time, so the child should be learn about how to deal with my mother. And even father in front of, whenever reactions will be on going to father, so that time the child should learn about, so how we can say as a how we are going to dealing with fathers. So that time you should not give any type of things your objectives whenever the child is demanding. Distract your child away from the tantrum. Most of you parents are using of that the distractions whenever we are going to parties and somewhere, and child maybe suddenly crying, starting crying, and at that time we are shouting that child, and we are going to upset it, that we are going to mood swing that. So that time we have to, as a parents, we have to using that distractions. So we can say the whenever that time situation happen in this some situations, so we can carry out the children's outside and roaming there, and suddenly distract to sometime others, okay, just like as a the activity we are going to done, which is more likely by the children's. Okay, next one is that the plan for the tantrum. You should about aware about that what are the tantrum, about tantrum, and you have to plan according to tantrums, right? So that that plan should be excellent planning, we can say as a tantrum. That time you should, as a parents, you have understood very well about the behavior of children. So you are as a, you are aware about the behavior of children whenever the child is going to anger or not. So you should first of all making as a plan for the tantrum. Just one of the example is that if the favorite toys are in on the there in the ground floor, and some other children are there, and you should know about that time, if children are going to play their children, so that will be time to again appearing as a tantrum in this child. So you should remove it before is that happen situations. You should control it about that. So these are the things interventions are. Next one is that breath hold spell. Okay, that is a breath hold spell. That is a one type of behavior disorder in age group of toddler. Breath holding, that is a temporary stopping as a process of breathing, and a spell, that is a do instance. Okay, so that time whenever the child is making a cry as a most of thing, and that time child should be forget about taking a breathing. So that time that is the reflexes are going to appear in that time. So you should be aware about that time of the behaviors. So what are the definitions says that? Definition says that that is a breathing holding spell are briefly period, and when the young children stop breathing for up to 1 minute. A breath holding spelling usually occur when the young child is angry, frustrated, in pain, or afraid. But the spell is as a reflexes. You should know about the reflexes about the breath hold spells. So how we can deal with that, the situation? Okay, some the information is there. If your child has a breathe holding spell, and if your child has a pass out, so you have to done this type of the things. So first of all, that lay your child in the crib on the floor. Okay, you should then lay down of the uh, child on the crib floor, and keep your child away from anything hard or sharp. Stay with your child whenever you are going to work, and you should complete it at before, and stay with child most of. And if your child had as a pass out, So you should try to stay calm with reassure yourself that your child is safe, not to worry about that time, not you have to react that time. And check your child mouth for the food, any objects that could be cause choking. So these are the information you should aware about that. Next one is that is a thumb sucking. Okay, so most of behavior disorders in toddler age we are aware about, that is a thumb sucking. So thumb sucking, that is a finger sucking, is a habit disorder due to feeding of insecurity and tension reducing activities. It may develop due to inadequate oral satisfaction during early infancy. As a result of poor breastfeeding in older children, this habit may develop when they are tired, bored and frustrated, or at bed, or want to sleep but feel lonely. So that these are the some behavior disorders in the toddler age, that is a thumb sucking. Whenever children are going to insecure feeling and emotions for, and we can say as a frustrated, so that time maybe have appears. So how we can manage about the thumb sucking? Okay, we are going to learn something new. So as you can see that whenever a child is going to thumb sucking their thumb, okay, when the thumb put on their the placing of their mouth, and that will be happen is that the teeth line, okay, maybe teeth line may be disrupted to their area. Okay, whenever child is going to smile in afterwards, and that will be appear like this one. So these are the some disorders, and we can say as distortions of the thumb sucking. So how we can managing that? What are the intervention is that? So first of all, that counseling that is explain to the child why this is harmful to this repeatedly. If we are going to repeatedly doing this one, and you should explaining to the child, and you should know about, and you have to just explain about that parents, if the child is going to continue thumb sucking, that will be happening in their futures. And next one is that the reward. This is basically gift to the child with something he like based on the good behavior. And whenever you are going to offer that children to reward, and basically that will gift reward, that will be affected. Punishment, do not hit the child. Punishment, that is not a punishment. Do not hit the child, just take away something he like for more will. Whenever the child is going to thumb in starting, and punishment that not hit as a physical, you have to just remove their favorite toy whenever going to this type of activities. So you can aware about that, this type of pictures. So next one is that apply chili oil, neem oil on the thumb, and this will deprive, we can say, as a take away the child of the pleasure of thumb sucking. And distractions, you should distraction about that activities, playing some time of making up drawing, and during the board time, and engage the thumb or finger for the other activity will be practice or to keep the hand busy. Okay, like this according to their images. Next one is that nail biting. Most of occurring the habit disorder in toddler age, that is a nail biting. That is a repetitive behavior that destroys the fingernails, the skin around the nail, and cuticles. It is a sign of the tension and self-punishment to cope with the hostile and very strong. That is meaning of very strong feeling against that somebody or something. A feeling of toward parents. It is caused by feeling. It is caused by feeling of insecurity, conflict, and hostility. So how we can manage as a nail biting? Whenever we are seeing about and whenever observing that the children are going to be nail biting, so you should the cut nail short first one, and your toddler can't be bite for what is not there. So keep the nail when well trimmed, and this also ensure that bacteria and dirt catch under the nails and don't into the toddler systems. Create a code. As a parents, you should know about that what are the create of the code instead of the telling your child to to stop and nail biting, choose a secret code that you can use to remind them to stop. An option include the specific word that you should touch on the shoulder or whistles. Okay, whenever you're going to code settle to the childrens, you should say and you should ask about that. I'm gonna tell you to the such a this type of code whenever going to do like this. Used as a reward system and offer your child as a small prize and put their star on the sticker and chart for each day they don't bite their nail at the price of the end of week, and they get to choose a prize. So reward system will be benefit for that according to the nail biting, and that will be affected in their the futures one. Apply bite averting nail polishes. So this type of nail polishes are safest to the children's, but as a little bit test or bitter are the that time of test. So burning test and get the thrill out of the nail biting and the make your child more conscious of the habit. So whenever we are going to apply this type of nail polish on their nail, it will be tested as a bitter, and that is a burning sanction. So that type of intervention we can use in the nail biting. Okay, so that is the references about it. Whenever I'm going to take content, this type of content, that is the references I have to take in some YouTube, and I can take some content. This type of content I have taken from the articles and books also. Okay, thank you so much for this listening me, and we are going to covering that the toddler age behavior. Okay, so I hope you will understand very well, and thank you so much.